health program and is the host of Dr. America, the radio show. Dr. Sriram has been very active in talking about what Medicare for All will mean for low-income communities, for communities of color, and he's been very interested in centering discussions about racial justice and social justice more broadly within the Medicare for All discussion. So we're really glad to have him as our moderator today. Thank you so much. If you didn't sign in before the briefing, please sign in after, and we look forward to this discussion today.
Thank you for that introduction, and thank you for this opportunity to moderate what I think is going to be a really excellent panel. My name is Dr. Sanjay Sriram. I'm a pediatrician in Anacostia, and very happy to be here. I am a relative newcomer to the Medicare for All fight, and my journey to this cause was that I came to realize that my patients, they benefited tremendously from the ACAs.
Turn it on.
Oh.
It's not going to light up.
It's not going to light up?
Yeah.
Oh, okay, there we go. Okay. Okay, I came to the cause of Medicare for All mainly for the sake of my patients and families, for whom I realized that the Affordable Care Act was important but insufficient. And I think that the more that I learn about Medicare for All and what it would mean to predominantly minority and low-income communities and families, the more I believe in its urgency, and the less I see it as a radical idea and more as just a necessary evolutionary step in American healthcare. And to help us broaden the conversation about Medicare for All, we have an excellent group of panelists. I'm going to turn things over to them right now. And what I'm going to ask each of the panelists to do is that I'm going to, I'll pose the question to you, and if you can just introduce yourself as you answer the question, that would be great. So the first question I have is for Mark Dudzik from the Labor Campaign for Single Payer. And Mark, my question for you is that earlier this year, the Supreme Court struck a major blow to workers' rights with its ruling on Janus. And I was wondering if you could walk us through what Medicare for All would mean for workers and their families in the current labor landscape.
Okay, thank you, Doctor, and good afternoon, everybody. So I am Mark Dudzik. I'm the National Coordinator of the Labor Campaign for Single Payer. We're based right here in Washington, D.C., and we do exactly what our title says. We work to move the national labor movement into this fight to win Medicare for All. So, Doctor, your question is really right on target. You know, the rights of workers to organize and to bargain and to act in solidarity with one another are really facing existential threats right now. And there's a whole series of reasons why that's happening, and causes and effects, not least of which is a long-term campaign led by groups like the Koch brothers to undermine the independence and the ability to act on the part of the American labor movement. But one aspect that we maintain has seriously contributed to this crisis is the fact that in this country, healthcare is linked to employment, and it has in fact become an albatross around the